Welcome back. Thanks for staying with us. This is Daybreak, and many thanks for your company. The hashtag on X is Citizen Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikari. Dr. Muriuki PJ is the Director of Dental Services at Nairobi City County Government. Thanks for your time, Dr.
Thank you so much, Ayub.
Much appreciated.
Thank you for having me.
And many thanks for your presence here. We'll come back to the demonstrations and here to talk about, of course, demystifying dentistry. Yeah. And this is a subject that many Kenyans and our audiences would want further information on. But first, generally, explain to us the aspect of dentistry before we get back to the very specifics to further do the demonstrations here on the table.
Right. Thank you, Ayub, for having me. And I'm really happy to continue this journey of demystifying dentistry. Right to your question, dentistry is one of the specialties in the medical field. Currently in our country, it's taught in 2 universities, the University of Nairobi and Moi University. And it takes about 5 years, and then you have 1 year of internship. And when you qualify, that is when you are called a dentist or a dental surgeon. However, there are also other cadres within the field of dentistry that are recognized in the country. We have a course called Community Oral Health Officers. Okay. These Community Oral Health Officers, basically, they are meant to be in the community, teaching people about how to take care of their oral hygiene and how to prevent dental conditions, because most of the dental conditions are actually preventable. Okay. So their work, they are trained at a diploma level. They are not assistant dentists. They are basically, their cadre is basically to deal with preventive and promotive dental care. Yeah. All right? Then the dentists now do the curative part of dentistry. Okay. Then also we have people called dental technologists. Okay. Just like we have the medical technologists where you go to hospital, they take your blood samples and they do the tests. In dentistry, when, for example, we are replacing teeth and things like that, the dental technologists are the ones that are supposed to deal with the prosthesis. So they are not supposed to touch patients. They are basically supposed to deal with the work that they are given by the dentist. Yeah. So basically that's what is the landscape in the dental field. Okay.
Beyond the explanations then, there are 2 critical factors here, oral health and oral well-being. Yes. We'll come to the do's and the don'ts, the contributory factors. Some, of course, are as a result of our actions and what we ingest. Yes. Tell us more about oral health and oral well-being.
All right. So oral health basically is the well-being of your mouth. Most of the time when you're talking about oral health, people think it is just the teeth, but it is actually the whole mouth. You have your lips, you have your tongue, you have the teeth, you have the back of the mouth, which is called the oropharynx, you have the palate and all those things. When you are talking about the oral health, and its connection to the overall health of the body, we normally say the mouth is the window of the body. And it's really unfortunate because sometimes people tend to take the mouth and take it away from the body. But the mouth is actually part of your body, and that's the mirror of the rest of the body. Now, when we talk about oral health, we mean how you take care of the teeth and the other tissues that are in the mouth. So we talk about brushing as the most basic thing, that you're supposed to brush your teeth to prevent dental conditions. And I'm sure you'll talk about the various dental conditions and what happens if you don't brush your teeth. Secondly, oral health is connected to the general well-being of the body. If you do not take good care of your oral health, then it means the rest of the body can also get affected. I'll give you an example. For example, one of the most common diseases in the mouth is gum disease. Gum disease is where you have inflammation of the supporting structure of the tooth. So if you look at your tooth, and you'll allow me to use just these models to demonstrate. So you have what we call the tooth as we see it. The tooth has 2 parts. There is the crown, all right, the white stuff that we normally see, and we have the root. The root of the tooth is usually anchored inside the bone, which is surrounded by the gum. So when you're talking about gum disease, it is inflammation of the surrounding structure of the tooth or the supporting structure of the tooth. Now, gum disease means that gum is inflamed, all right, because mostly of plaque. Plaque is the food that is left over in the mouth, and the bacteria act on it, and it causes inflammation. So when you have, for example, gum disease, you can have other conditions, systemic conditions, like heart disease, all right? So when you have gum disease, for example, you'll find that the bacteria that cause gum disease are also the same ones that cause some of the heart diseases, all right? When you have gum disease, if you have like diabetes, you have diabetes and you have gum disease, you'll find that the management of that diabetes will be affected. So if a patient has uncontrolled gum disease, you'll find even if they take medication for diabetes, it is not getting control. So in a nutshell, whatever happens in the mouth mirrors what will happen in the body. And some of the factors that contribute to some of the systemic conditions in the body are also the same ones that cause diseases in the mouth.
Okay, yes. So let's come to the cleaning question here. And you talked about brushing and the dental conditions. What are the types? And for example, I prefer using a traditional toothbrush.
Yes.
Is it advisable? I haven't had any problems with that. And a majority of the people prefer because of where we come from in the rural setup. And tell us about the types of these dental conditions.
All right. So generally speaking, I would say there are very many dental conditions, but for the sake of this discussion, let's focus on 3.
Okay.
So the first one is what we call dental caries. Dental caries is what we normally refer as cavities. So what causes dental caries? Dental caries, again, is caused by bacteria in the mouth. We know that the mouth has a lot of bacteria. When this bacteria is in the right environment, we have what we call a symbiotic relationship. So this bacteria is helpful. However, if the conditions in the mouth change, the pH in the mouth changes, this bacteria can be harmful. What would make the environment in the mouth change? Poor oral hygiene. Okay. So if you don't brush and there is food left over, this bacteria now will, together with the food that has been left over in the mouth, will cause havoc on the teeth. It causes what we call demineralization of the teeth. So basically, it causes the outer layer of the tooth, which is called the enamel, to start having a cavity. All right? So when that cavity forms, it will continue getting deeper and deeper. When it is on the outer layer, which is the enamel, you usually don't feel pain. All right? So you just see some black spots on the teeth, but they are not painful. But then there is a middle layer inside the tooth, what we call the dentin. So when it gets there, that's when the patient will come and tell you, Doctor, I'm having sensitivity. So anything hot, anything cold, that's when I'm feeling it. So that means that cavity has reached the dentin. Then when now it reaches the center of the tooth, what we call the engine of the tooth, is the inner aspect of the tooth, which is called the pulp. In the pulp, we have the nerves, we have the arteries, we have the veins. When that infection now gets there, that's now when a patient will come and tell you they have a toothache. And the pain is usually very, very severe. I don't know if you've ever had a toothache.
Never had one.
Yeah, please don't wish to have one. It's usually very, very painful. So that's one of the most common conditions where patients come and say they have a toothache. But the actual disease is what we call the dental caries. And like I've said, it's a progressive condition. And therefore, it is very important for patients to make sure that they visit their dentist so that it can be identified early and it is managed at the right condition. So the second most common is what we call gum disease. In fact, just to go a bit of statistics, we have what we call the Kenya National Oral Health Survey. It showed that 9 in every 10 people have an unresolved dental condition. And most of the time, it's usually the gum disease. How does the gum disease come about? Like I said, there is the gum and the tooth. So between the gum and the tooth, this particular area here, there is usually a pocket. It's called a gingival pocket. So this pocket is like what you have on your nails, the space between your skin on the finger and the nail.
Yes.
So the nail bed. So that space over there, when you eat, there is usually some food that gets there. So when you are brushing and you do not brush that out, so what will happen is it will start causing inflammation around there, and then bacteria are going to infiltrate that gum, and it starts getting inflamed. So when it starts getting inflamed, it starts running away from the tooth.
Okay.
Remember, a tooth is anchored inside the bone, surrounded by the gum. So for gum disease, the problem is not the tooth. It is the support structure of the tooth. So what will happen is the gum a normal tooth should be covered by gum like this.
Yeah.
So
that's tooth number 1, yes.
This is tooth number 1.
Yes.
So as you can see, the whole root is covered inside the gum. But now when you have food and bacteria getting inside that space over there, it starts causing inflammation. And when this inflammation is chronic, the gums start bleeding. Okay. So you'll hear patients coming and saying, every time I brush, I'm spitting out blood. Why? Because of the plaque, all right, that is in between the tooth and the gum, causing inflammation of the gum. If this is not cleaned out, and by the way, this plaque, if it is not removed by brushing, it actually solidifies. It solidifies to the point where it is as hard as a tooth. And that is why some people will come with some black stains around the gum. Or, you can clearly see there's something, and they try brushing, it doesn't come out. Because it has solidified, because the mouth has calcium, which usually now solidifies the loose food onto the tooth. And that cannot come out with a brush. So when it is chronic, the gum continues running away from the tooth, and it now starts eating away the bone that supports the tooth. So when that happens, with time, you'll find that your tooth is becoming longer. It is not like the tooth is growing. No, it is because now what we are seeing is the crown plus the root. And again, if it is not corrected, what you'll have is the tooth will start shaking. And eventually, you will actually end up losing the tooth because it is not well supported.
The foundation becomes weaker.
The foundation, just like a house or anything else, if the foundation is affected, then now you end up losing even a good tooth which does not have a problem. And it's a very common problem, especially in our setup. Like I said, statistics show very many people are affected by this condition. So it can be from mild, all the way from when it's starting, all the way to severe, when now the teeth is very shaky. And another thing, Ayub, is that when you have gum disease, you also have bad breath. Because of the plaque and the bacteria that are
So let's come to the questions of brushing now. How should it be done? 1, how many times a day? And 2, the procedure. I mean, there are some people who have challenges even with the toothbrush, for example, that you're holding. And what type of a toothpaste can someone use, for example, in the normal circumstance and in circumstances where you have said that the plaque goes from what was normal to severe, where you may end up losing that tooth or the teeth?
Good. That's a very good question. And, if you look at it, the whole point of brushing is to disrupt the formation of plaque. We said plaque is formed by bacteria and the food left over in the mouth. So that's the whole point. Anything that you use that can disrupt that plaque will suffice. So in most people, you find that we'll use a normal toothbrush. So for a toothbrush, you just want to get a toothbrush that is medium bristles, because when you have a toothbrush, you have the handle and you have the bristles. So for a good toothbrush, you want a brush that is not too hard, because again, when it is very hard, it causes what we call abrasion cavities. So you self-inflict cavities because of using too much force or a very tough brush. So the one that we recommend is a medium. They're usually written on the packaging that a medium toothbrush should be okay. Back to your question on the traditional twigs. They are very good, very good. Actually, if you are not able to get a toothbrush, you can use those twigs. However, what is important is how you're doing it. Because again, too much force or very hard bristles, again, will make the gum to run away.
Okay.
When it runs away, exposes your roots, and you might end up with what we are calling the abrasion cavities because of the friction, or you end up having what we call cervical, the cervical cavity and the gum receding from there. So how do we brush? So we normally prefer if you can be able to brush after every meal.
Okay.
Because again, we said plaque is formed with the food leftover.
Yeah.
So if you're able to brush after every meal, well and good. But then again, you have to be practical. We normally say at least twice a day. When we were in primary school, we used to be told, we used to sing a song that you wake up in the morning, you brush your teeth, and then,
Yeah.
But actually, if you look at it, you've said the whole essence of brushing is to remove the food left over.
Yes.
So now if you brush before eating, it doesn't make sense.
Okay.
So what you should do is you take your breakfast. If you want to brush, you can brush, but still after your breakfast, you have to brush.
Yeah.
So you brush, and how do you brush? I can demonstrate using this. So the most important thing, like we say, the brush and toothpaste. Toothpaste, you can use any. So long as it is fluoridated toothpaste. Why do we insist on fluoride? Because fluoridated toothpaste is very important in prevention of formation of cavities. All right? So it is very important. I know there is a lot of
different brands.
So that really doesn't matter.
Yeah.
So you use your toothpaste and just use a sizable amount, just a small amount. There are people who coat the whole brush with toothpaste. Again, that is not recommended. So once you have your toothbrush and your toothpaste, so what you do is you segment your mouth into 4. So you have the upper right side, upper left, lower right, lower left.
Okay.
The most important thing is we said there is a space between the tooth and the gum. And that is where most of the food usually hides, and the plaque.
Okay.
So you normally angulate your brush at 45 degrees towards the gum. Again, you do circular motions like that. If you look at what I'm doing, some of the bristles are actually getting between the tooth and the gum. And that is what we want, so that pocket that is around there is cleaned. So you do that, and notice the motion that I'm using. I'm using circular motions.
Okay.
Right? You cover around 3 teeth, and then you do circular motions like that as you move forward. Most people use this.
Yeah. Which is now putting pressure on the gums.
Yeah, putting pressure on the gum, and the gums will actually recede, and you will end up having those abrasion cavities. So we want gentle force, medium toothbrush, and the right technique, which is angulate your brush 45 degrees so that it's able to get to the pocket that we talked about, and then you clean moving forward. You do the same on this other side. On the lower side, again, angulate 45 degrees towards the gum.
Yeah.
Then you do that, all right? The same thing, the other side. Remember, the tooth has different surfaces. So you don't just clean what people can see, and that's the mistake that most people do.
Yeah.
They just do this. But actually, where we have most of the dirt is the biting surface and the inner side of the tooth. Again, on the biting surface, make sure you clean. On the inner surface of the tooth, do the same. Again, where most of the patients will have a lot of dirt is behind the front teeth, on the inner side. Why? Because it's not an easy place to brush. You have to be really conscious when you're brushing it, and make sure that, again, you take your time. How many minutes should you use to brush?
On average?
2 minutes.
Okay.
Around 2 to 3 minutes, but most people just do 30 seconds and they're out, which is not good. Lastly, when you finish, you can rinse your brush and brush your tongue.
Okay.
There's a question that I normally get asked a lot about whether you're supposed to spit or not. All right? Ideally, we say to use very minimal toothpaste. So the toothpaste has a protective ingredient in fluoride. So what we normally recommend is if you are able to brush and don't spit out, well and good. So that the fluoride can still remain in the mouth to help in making sure the mouth is okay. But if you have to rinse, don't over-rinse. You just rinse, the excess that is in the mouth and leave it to stay in the mouth.
Okay.
Yes.
So we'll come to the procedures because many people also, out of beauty nowadays, you had seen undergo procedures to just make their smiles look better. But let's talk about tartar then, which is the hardened part of partly what you have talked about, and the causes. So, for example, how many times in a year should I see you?
Good question, and I'll start even from the kids. Most people ask, when should kids start seeing the dentist? I normally say, you see the dentist the moment you see the first tooth in the mouth. So whether they have a problem or not, just take them to the dentist, because some of this information that I'm disseminating right now, you'll also be able to get it from the clinic. So in the clinic, it's not just treatment. You also get professional advice. Yeah. So for kids, as soon as they start teething, you should see a dentist.
Starting with the milk teeth?
Yes. Yes. Milk teeth are actually very important teeth, and we'll come to that. Then for adults, we normally say at least twice a year. That is every 6 months. For routine checkup and cleanup. Cleaning, because in as much as you're brushing, there are areas of the mouth that you're not able to access. And especially the pockets that we're talking about. So it is important you get a professional clean. However, this is just a general rule of thumb. There are people that we, for example, who have severe gum disease that would even tell to come every 2 months, all right? Because you need to control that disease. There are other patients that you see and you tell them to come every once a year, depending, all right? So it is dependent on the case that is at hand. But as a general rule of thumb, we say at least twice a year.
Yeah. So also let's talk about some of the contributory factors. And before I come to that, follow up on the question on the milk teeth, which now brings us to the demography aspect.
Yes.
Of course, children and then adults. How cautious should one be, especially with children? And for example, coloration question, which is because of factors that are environmental, like the water that people drink in certain parts of the country, which are salty.
Yeah.
Does that raise a concern? Do such people need cleanups? And for kids, in the case of milk teeth, how constant can they be checked upon?
All right. So for kids, like we said, they should have their first visit when they start having their first tooth. Milk teeth, and this is actually a myth that I don't want to demystify. Yeah. People think milk teeth are not important. And my question is, if they are not important, then why are they there? I want to put it to you that they are very important for 3 reasons. Number one, these milk teeth, they are the ones that are used for nutrition. You know, remember, nutrition starts in the mouth. So if you do not have teeth to eat, then it will affect your nutrition. So these kids need to eat balanced diet. They need to eat all the things that they're supposed to eat. If they have issues with their teeth, what that means is then they'll not be able to eat properly. So when they develop cavities, for example, those milk teeth should be filled. Yeah. Because the way God made us, the milk teeth have a specific time when they're supposed to come out. So if you remove a milk tooth before it's time for coming out, then you will have a problem, because that space is going to close. Yeah. And that brings me to the second function of milk teeth. We say the first one is nutrition. Yeah. Second function is they maintain space for the permanent teeth. Okay. And that's why I said, if, for example, for any reason, either a gum disease or a cavity or whatever reason, you go and your kid has a problem and you just want the tooth to be extracted before its due time, what will happen is the space it was occupying will close up. When it closes up, it means your jaw is becoming smaller. And when the tooth that is supposed to come out from that space, when the time reaches, because it doesn't just grow because that tooth has been removed. When that time reaches, what will happen is that space will have already gotten depleted. And that is why you're seeing some kids having teeth growing on top of the others. Yeah. Because they do not have space. So they should be maintained for space. Number 3.
Ideally, until the average timing for that's the automatic replacement by the permanent teeth? So ideally, it should be natural, is it?
It is natural. Actually, it should be natural because they start teething at around 5 to 6 years, where you start with the front lower teeth. Yeah. So they shake and they come out.
You gently remove.
You gently remove. However, nowadays we are seeing what we call ectopic eruptions. Just like we can have an ectopic pregnancy, it's where a tooth is growing behind. Because what should happen is they should be well-oriented so that the permanent tooth is directly under the milk tooth. Yeah. So that when it's growing, it dissolves the root and it shakes and it comes out. For some kids, you'll find that the milk teeth will not shake, despite the time for them to come out. Yeah. Why? Because they are not aligned. They are not in the same position. Mm-hmm. So it is called an ectopic eruption, and that's where the dentist gets in.
Ideally, it's the permanent teeth that then displaces the milk.
Yes, it displaces naturally because it is directly under it. But if it is not there, ectopically erupting, then it's not going to push it. So you'll have 2 rows of teeth, and therefore the dentist has to come in.
Okay.
So the third, like you said, there is usually a schedule, all the way from 6 years to 12 years. Mm-hmm. So if a tooth that is supposed to come out at 12 years is removed at 7 years, it means the space is going to close. And the permanent teeth will come out as on the side. And that's what we commonly call homie. You know, people saying it's like an extra tooth. It's not an extra tooth. Yeah. It is just a tooth that did not have enough space to grow. Then the third thing that milk teeth are important for is speech. Do you know that your teeth help you to pronounce some things, some words? And if you don't have teeth, there are words that you cannot say. You know, there's one that we commonly use in dental school, like saying Mombasa. Mm-hmm. If you say Mombasa, you'll find that your teeth are actually meeting. They're actually helping in the pronunciation. People without teeth will say Mobava, you know, because they're trying to compensate for that, right? So they are very important in development of speech. And remember, these kids are developing their speech. So if you lose those teeth at an early stage, then also the speech is going to get affected. So in a nutshell, milk teeth are important and they should not be removed unless they are ready to be removed. And when they have issues, they should be treated.
Okay, so let's come to the understanding of the common dental procedures.
Yes.
And take us through, for example, dental filling. In the case of the deep cavity we talked about, which touches the root and the severe pain that a patient undergoes, what happens? The removal of the teeth, or ideally, how do you cover that up if somebody doesn't want that removed?
Right. So, like we said, there is different stages. We said dental cavities or dental caries is a progressive disease. So we say the tooth has 3 layers. The outer layer, what we see, the enamel, the dentin, and the pulp. The pulp is the engine of the tooth where you have the blood vessels and all those things. Now, when the cavity is starting on the enamel, most of the time you don't even feel pain. When you go to the dentist, what they'll do is they will remove the decayed part and put a filling. All right? Why? The infection has not gone beyond. Okay. However, if we wait, just like most Kenyans are fond of doing, and because, you know, I'll not go to the dentist, I'm not in pain, what will happen is that cavity will get to the dentin. When it gets to the dentin, you start having sensitivity. So anything hot, anything cold, you're feeling a lot of sensitivity. So that is a warning that that cavity is in the dentin and it can cause pain if it is not corrected. So again, when it is still in the dentin and the enamel, that is when you do a filling. However, when now the infection gets to the nerve, that is when now you hear patients are in severe pain. You cannot do a filling, right? So what should be done is what we call root canal treatment. Okay. So root canal treatment is where you get inside the tooth, all the way to the nerve, to remove the infection that is inside the roots or inside the nerves. Yeah. So basically you remove the nerves and the blood vessels from that tooth. What you do essentially is to make that tooth non-vital or not living, because the reason why you feel pain is because of the nerves. So you get in, clean the infection, remove the nerves, and therefore now you can now again put a filling. So by doing that, removing the infection and the nerves, that tooth will be there eating, but it cannot feel itself. All right?
It's a dead cell.
It's a dead tooth in quotes. All right. However, in some cases, some people wait for too long and the infection becomes too much. When it is too much and the tooth is badly damaged, then you have to do an extraction. So it is not the patient's choice of whether they're going to do a root canal or a filling. It is dependent on the condition that they present in.
Yeah.
Yes.
And many things are done in the modern world because of beauty. Is whitening of the teeth necessary when you have no problems with your teeth? I mean, we have seen the lengths people can go at the expense of looking for beauty and even smiles that they fancy so much.
Good question. And just to take you back, I've just remembered there is a question you had asked about kids and the brown teeth. Yeah. It is actually a very common problem nowadays. It is what we call discoloration of teeth or dentofluorosis. So dentofluorosis is where the outer layer of the tooth becomes affected during formation. The outer layer that we talked about, enamel, it gets affected during formation by consumption of excessive fluoride. So fluoride is normally contained in water. So this condition used to affect mostly people from the Rift Valley, in Naivasha, Nakuru, and stuff like that. But nowadays, we are seeing it more common in the Nairobi metropolitan area. Why, you may ask? The main reason is you'll find that the population in these urban centers has really ballooned, and the water supply is not commensurate. So most people are actually using borehole water. The scientists, the geologists have told us that our rocks underneath have a lot of fluoride. So now when you take that water and give it to a kid, either an unborn child who's still developing their mother's womb, or a kid between 0 and around 8 to 10 years, what will happen is this fluoride, the excessive fluoride, will get deposited in the teeth. And it will affect the calcification of the tooth. So when the tooth now grows, it comes out very weak. Sometimes they look chalky white and they're just mottling. And in some cases, you'll find that now the tooth is even severely discolored. It is a condition, like I said, which we are seeing very common. In fact, the Kenya National Oral Health Survey by Ministry of Health showed about every 5 in 10 children have this condition, and it is a condition that is affecting people. Back to your question on whitening. Now, when those kids have that discoloration, it will definitely affect their function because the outer layer, which is supposed to chew, is not there. And it will also affect their aesthetics because now the teeth becomes brown. And you can imagine, Ayub, the amount of ridicule that these kids can go through in school. So in such cases where the tooth is severely damaged and discolored, whitening is critical. It is important so that you are able to make sure that the teeth are well covered so that they can be functional and also to restore their self-esteem. So in these cases, we normally do what we call masking. So masking is basically using a filling composite material to cover out the discoloration and restore the tooth to its normal morphology and shape. Now, back to your question, there is a growing demand of some of these services. And, you know, I think someone said beauty is in the eyes of the beholder, and people perceive beauty differently. So in some cases, a patient will come and tell you they want their teeth whitened. And as a professional, what you should do is you're supposed to assess, because you're the one who went to school and who knows what is normal and abnormal, and advise your patient accordingly. So in some cases, what is happening is most patients are going to people who are just either not qualified to give these procedures, who have no foundation in science. All they want to do is just make money from them. And you'll find that there are so many, and I'm sure you've seen that, so many dental clinics that are coming up everywhere. And let me shock you that most of this, in fact, more than half of these clinics are not run by dentists. They are run by either underqualified or outright quacks. And that is why you find that some patients will go, ideally who should not even have had some of those very intrusive or invasive procedures, but they end up having them. And if it is wrongly done, you'll end up with a lot of sensitivity. It might even end up with a lot of pain, and eventually you might even lose the tooth. So just to piggyback on your question, the most important thing is you get professional advice. Because you can't come, for example, you can't go to a doctor and tell them, I want this finger amputated. I mean, that doctor must be very mad to just go and amputate your finger. Yeah. They're supposed to tell you.
Procedure must be followed.
Yes, procedure must be followed. But now the problem we're having is there are a lot of unqualified people masquerading as dentists. And patients are really suffering out there, where you find they go, have very invasive procedures that ordinarily they should not have had.
Okay.
Yes.
So also, this takes us to the question of dental implants then. At what point is that considered from professional perspective?
So dental implants is one of the ways, I dare say the best ways of replacement of missing teeth. So implants are used to permanently replace the missing tooth. So it depends with whether you've lost one tooth, is it multiple teeth? So that is when you do the implants. It's actually one of the ways, because other ways of replacing missing teeth, we have dentures, we have crown and bridge, and many other options. But like you asked, dental implants are usually one of the best ways of replacement. It is actually a surgical procedure. And like I said, it has to be done by a qualified person, because otherwise it can really go bad if it is not done properly. So it involves 2 stages. The first stage is a surgery. So the surgery, you just go and expose where you removed the tooth, you expose the gum, you get to the bone, and you drill onto the bone where the roots used to be and put the implant.
The cheekbone.
Yes, the bone that's supposed, yes, this bone here. So where the teeth used to be.
Yes.
So where the tooth is missing, if the tooth is missing now, you place the implant inside the bone, then you leave it for about 2 months. Some cases you can do immediately, but most, the gold standard is where you do what we call delayed restoration, where you leave the implant. When the implant is placed inside the bone grows into the implant, all right, and makes the implant to be firm. Then finally, you come in and put the crown to replace the missing tooth. So that is what is called a dental implant.
Okay. And the question of the kids again. Someone is asking, please ask, when is the right time to put braces on a child and also on stained teeth for children and whitening?
Yeah, I guess, I knew that question would come, because like I said, this issue of staining or discoloration of teeth is quite rampant. And like I said, you need to visit the dentist to assess whether they need to have any restoration done or not. As to the question of braces, the ideal age is when you have permanent teeth. However, in some cases where we see kids with very severe malalignment when the permanent teeth are growing. So in such cases, sometimes we do what we call interceptive orthodontics or early braces to correct or to intercept a problem from happening. So in cases, select cases, case selection is very important. So the rule of thumb is when you have the permanent teeth, ideally around 12, 13 years. But in some cases where you predict that the outcome is going to be worse if you wait, then you can have what we call early treatment to align the teeth and sort out the patient before they lose all their teeth.
Does overbrushing or overcleaning affect the enamel?
Yes, not necessarily the enamel. It is what we said, the gum receding. Yeah. And by the gum receding, it exposes the root. Remember, the root is made of dentin. It doesn't have the enamel. So it's just dentin covered by something we call cementum. So when the gum runs away from the tooth and exposes the root is usually very soft. So what will happen is you'll end up having what we call the abrasion cavities. So you end up having cavities along the gum lines, which are usually very sensitive. Yes.
Okay, so apart from that, in terms of for example, in a year we talked about how many times one can see you or any other dentist. How much of what we ingest contributes to this? In the case of drugs now, drug abuse, the case of hard substance that people abuse. For example, the chewing of mira or cat because of the green substance, cannabis, and there's this drug that people put under between the
Kubel.
Yeah, Kuber, yeah. How much does that affect the health of the teeth?
No, the effect is far-reaching, not just on the teeth.
Yeah.
So, of course, they're obvious. They'll get a lot of staining. So the teeth become stained. They have what we call halitosis or bad breath, all right? Because those things will make your mouth to smell, including smoking. You know, there's a smoker's breath. You know, you can always tell someone is a smoker by the way they smell. But more concerning with this mira and shisha and this kubel is what we call oral cancer. So we have seen a rising case in oral cancer, especially among the drug users. You know, the ones who chew mira and you know, abuse other substances. So other than just what it does to the teeth and the gums, there is also the oral cancer where you get cancer of the surrounding tissues of the gum. So either on the gum, on the bone, or on the cheeks. And the most common kind of cancer is called oral squamous cell carcinoma, which again we are seeing a lot among people who smoke and those people who abuse drugs and mira chewing. Actually, it's very rampant in Meru because you see people abuse a lot of mira there.
Yeah.
Yes.
We'll get the feedback on the SMS. There's a gentleman asking here if it's okay to brush your lips.
Yeah, I mean, sometimes they get scaly, so you can just gently pass your brush on them. But most importantly, what you're supposed to do is you're supposed to use a lip balm to protect them, especially where you are working in direct sunlight.
Okay.
Yes.
So, Ibra, we can get the feedback on the SMS. This is what you're saying on 22422, just part of the conversation. Jen says, Daktari, just behind you, I took my 6-year-old child to the dentist due to a swollen left cheek. Upon examination, the lower gum was swollen and oozing pus, and the tooth was decayed. The dentist prescribed flagyl, amoxicillin, and ibuprofen.
Yes.
It still continues. The swelling has since gone down. However, since my child is only 6 years old, I was advised not to extract the tooth until around the age of 10. I was also advised to follow up with a pediatric dentist and a further evaluation and care.
Yeah, I think that was proper management. Most likely what happened is what we talked about. The infection getting to the pulp, so that causes pain. And also now it travels all the way down to the roots and the bone. So when it does that, you'll end up with a swelling. And this swelling is actually pus because it's an infection. So when you get to the dentist, what they're supposed to do is, first of all, manage the infection. Sometimes you even make an incision to drain out the pus. And then now you deal with the root cause, which is that affected tooth. There are many procedures, like for this particular kid, they can have what we call pulpectomy. Pulpectomy is like a mini root canal for milk teeth. And that should be able to sort out the problem.
Okay. So the next one, and which was from Elizabeth, was still on 22422 on the short SMS code. She says, is dental disease genetic? My mother lost all her teeth and she's only 76. My brother has all his molars replaced with artificial ones. I had more than 5 root canals, and now my son, who is just 8 years old, already has a cavity. What should I do?
All right. So there is... you know, there are factors that lead to, you know, gum disease and teeth decaying. So, and therefore you'll find, like we said, most of the reasons is the bacteria in the mouth and the food debris, the plaque. So those two are the main contributors to, you know, getting gum disease or dental cavities. So you'll find that people in the same family that are exposed to the same conditions, you might find that they are experiencing the same disease pattern. However, there is no real genetic connection of some of these dental conditions because most of the factors are known. For example, if you have poor oral hygiene, it is not a genetic factor. It is a behavioral thing, all right? So there's no so much genetic link to most of the dental conditions. However, you find that people who are living around the same area or in the same family, they're exposed to the same condition, food, and probably even hygiene practices.
Yeah. So with the final one here, because of time, we are 9:09, is from Mike. He says, hey, Ayub, my teeth have been aching, but I don't have any cavities. Can you help me understand what the problem might be?
Yeah, so there are quite a number of factors that can cause to teeth paining, and they should not self-diagnose. They should actually go to the dentist. The dentist is the one who should tell them they don't have a cavity, because most people think cavities is just what you can see, but we have cavities that form even in between the teeth.
Okay.
So it is important they go have a thorough examination, because virtually we might not be able to know exactly what is happening.
Yeah.
Yes, and by the way, they can visit, to deal with this issue of quacks, they can visit public hospitals. Public hospitals, for example, in Nairobi County, we have fully fledged dental clinics that are as good as private clinics. You can go to Mbagathi, we have a dental complex there where they can get... Pumwani, we've just, actually the governor is going to launch a mother and child dental clinic to attend to pregnant women and children. So some of these things never used to exist before, but we've seen a lot of improvement in terms of dental services, courtesy of our governor. So don't be exposed to quacks. Just visit Mama Lucy, Pumwani, Mutwini, Mbagathi, all the facilities that are under Nairobi County. The services are very subsidized, and you'll be able to get professional help from qualified people.
Dr. much appreciated.
Thank you.
Wait not for time, then this discussion will continue because it's very pertinent.
Yes.
Dr. Muriuki PJ is the dental chief dentist at the Nairobi County government. Much appreciated, Dr. for the explanations that you have offered us here.
And if they have further questions, they can just email them on or inbox me on social media.
Yes.
PJ Muriuki on Facebook and Dr. PJ Muriuki on Instagram.
Thank you so much. Much appreciated, Dr. Thanks to you too for waking up with us here on the broadcast this morning, and your company was worthy and appreciated. Many thanks for the feedback on the SMS code 22422 and on our hashtag on X, formerly Twitter, at Citizen TV Kenya and at Ayub Abdikadir. Thanks for watching. Good morning.